Hello there. My name's Sue Proctor, and I'm the chair of the North Yorkshire Safeguarding Adults Board. This is a statutory board of partner organisations who have a lead role in the safeguarding of adults. The board includes senior representatives from the NHS, social care and the police in North Yorkshire. It also includes representatives from public health, the independent care sector, community and voluntary organisations, Health Watch, fire and rescue, probation, the armed services and trading standards. We also work closely with the Children and Young People's Safeguarding Partnership and the Community Safety Partnerships as well. We meet 4 times a year. And this week, as part of Safeguarding Week, our meeting will be recorded live and available to watch. Safeguarding matters because it is at the core of professional practice. It starts with being aware of where risk of harm might occur, knowing how to prevent it, how to raise concerns with people who are in a position to stop it happening, and are willing to act to take someone away from that place of harm. Keeping communication and support going throughout an often difficult and emotional process. It requires a willingness to learn, to improve, and to share good practice. That's why events like Safeguarding Week matter so much. Firstly, they raise awareness and remind people that safeguarding is everyone's business. It's a great opportunity to share the learning from when things have gone well, and importantly, from when they haven't. This last year, because of the pandemic, we have had to radically change the way we work and the way we communicate as professionals. We've had to change the way different services work to involve families and service users. And this year, as you're aware, our Safeguarding Week events are held largely virtually. But it's so important to connect those professionals who work across so many agencies and different locations in the county. I hope that today has been really useful, inspiring and informative, and there's more to come the rest of this week. The impact of COVID will be with us for many, many years. During the last year, families have had less contact with loved ones. People have felt isolated, some anxious, some lonely, and some have felt abandoned in their isolation. For some, they have not even felt safe in their own homes and have become more vulnerable because of the nature of their general health and well-being, or because they are carers, or because of their work role. Inequalities have become more pronounced, and the mental health and well-being of many has been badly affected. But throughout this last year, despite all the challenges of the pandemic, colleagues from various agencies and locations have demonstrated a willingness to work better together, to connect with communities and families, to improve how we communicate, to better support families at risk. I'm really proud of all the work that colleagues across the agencies have done to keep individuals and each other safe during this terrible last year. And I'd like to take this opportunity to thank them all sincerely. So in conclusion, I'd just like to say, safeguarding matters because at its core is the importance of compassion for others, for being willing to act to reduce the risk of harm, and to do this with the best of intentions to ensure that we all have the ability and capacity to thrive, grow, and live our best life. Safeguarding is everybody's business.